All right, everyone. It is now 1:05 p.m. My name is Michael Karan, and welcome to the Tarrant County HIV Administrative Agency Subrecipient Monitoring Technical Assistance webinar on today, November 16th, 2022. A brief introduction. My name is Michael Karan. I work with Collaborative Research. We are a consultant to the Tarrant County HIV Administrative Agency, and we will be conducting your grant year 2021-2022 annual comprehensive monitoring site visits for funded recipients to test compliance with fiscal, programmatic, and universal standards. I'm going to pass it along to my other teammates and colleagues that are on the phone here. Thomas, would you like to introduce yourself?
Sure. Good afternoon. I'm Thomas Rodriguez-Schaeffer with Collaborative Research. Sarah?
Go. Hi, everybody. I am Sarah Seberg, and I'm also with Collaborative Research. Nice to meet you all.
Thank you very much. Now I will pass it off to the recipient's office. Lisa?
Hi, thank you all for joining today, and I appreciate Collaborative Research hosting this meeting. The monitoring this year will be a little bit different. It is comprehensive monitoring, will include all phases. This was a finding on our federal site visit, is that we needed to be doing comprehensive monitoring, which would add the fiscal to our normal program monitoring. So thank you all for your cooperation and for your participation this afternoon. And I think if the rest of the staff want to go ahead and introduce yourselves. Rebecca, I see you first, so you want to go ahead?
Hi, I'm Rebecca Seymour, and I'm the financial analyst for the AA, and I'm excited about the opportunity to have the comprehensive monitoring, and thank you guys all for being here, because I think it'll give us a really good look at how fiscal meets program and the rest of the operations, and how it's really important to look at the whole system. So thank you guys.
Renee, and then Caitlin.
Hi, everyone. I'm Renee Thomas, the Grants and Data Coordinator with the Administrative Agency.
Hi, everyone. Caitlin Lopez, Grant Coordinator, Quality and Planning.
Great. And then what we're going to ask, if all subrecipients, if you could use the chat feature and drop your name and the organization that you represent, so that we can make sure that everybody has an opportunity to introduce themselves. That would be very helpful for us. Again, if you could just drop your name and the organization in which you represent in the chat feature, that would be very helpful. All right.
I have a list going from everyone in the participant chat. If you'd like me to go through that, Thomas, real quick.
Sure, that'd be great. Thank you.
All right. First up on my list, I have Max Wilson. If you'd like to introduce yourself, please.
Hi, everybody. My name is Dr. Max Wilson. I am the Senior Vice President for Governmental Affairs at CAN Community Health, and am one of the team members helping with the Tarrant County Part C EIS program at CAN Community Health. It's a pleasure to be here.
Thank you, Dr. Wilson. Next, I have Astrid Edison.
Hi, this is Astrid Edison, Contract Manager for AHF.
Thank you so much. Next, I have Danielle Cameron.
Hi, everyone. I'm Danny Cameron. I'm the project manager for JPS Healing Wings.
Thank you so much. Next, I have Demetrius McDowell.
I'm sorry. Repeat that, please.
Demetrius McDowell.
Yeah, that's me. I thought I heard my name. Hi, everybody. This is Demi, and I'm Practice Administrator with CAN Community Health in Arlington.
Thank you so much.
Thank you.
Next, I have Jasmine Brown.
Hello, my name is Jasmine Brown. I'm Lead Case Management Specialist with the Salvation Army.
Thank you so much. Next, I have Daryl Neal Jr. I see in the chat you are also with Salvation Army. All right, Catrice Goodman Madison.
Hello, everyone. I'm Catrice Goodman Madison, Senior Manager of Behavioral Health for Tarrant and Ellis Counties with the Salvation Army.
Thank you so much. Next, I have Kelly Allen Gray.
Hello, Kelly Allen Gray, Executive Director, AIDS Outreach Center.
Thank you so much. Next, I have Michelle Pantaleo, but I have you in here twice. You're signed in twice.
Okay, that's interesting. I'm not sure how that happened. But I'm Michelle Pantaleo, the Director of Client Services at the AIDS Outreach Center.
Awesome. Thank you so much. And then Sandra Najuna. Let me see in the chat. Okay, we'll skip on. Next, I have Shamira Williams.
Good afternoon, everyone. My name is Shamira Williams. I'm the contracts manager for AIDS Healthcare Foundation. Nice to meet you all.
Healthcare Foundation. Thank you. Next, I have Will Mitchell.
Hello, my name is Will Mitchell. I'm the client service manager here at AOC.
Thank you so much. I also have Kimberly Russell.
Hello, my name is Kimberly Russell. I'm the case management supervisor here at the AIDS Outreach Center.
Thank you so much. And we just had some other people jump in.
We have Ms. Terry Walker Burston.
There we go. Thank you.
I'm Terry Walker Burston, the Director of Finance with the AIDS Outreach Center.
Awesome. Thank you. All right. If anyone did not speak up yet, please chime in.
Hi, my name is Johnny Watkins Mitchell, and I'm the Housing Assistance Manager at AOC.
Okay. Thank you, Johnny.
And do we have anyone from PMC on the call today? All right. So one thing that we will be doing today is this meeting is being recorded so that we can make it available to you for further reference at a later date if you need to go back and refer to something. And also if you would like other staff within your organization to review this at a later time prior to the monitoring session. So Mikey, I'll start sharing screen again.
Thank you, sir. All right. This is the 2022 monitoring process in a nutshell. So we will be covering the fiscal monitoring review, the universal monitoring review, and the service category chart review. So for our fiscal monitoring review, it will all be done via virtual. So we will use our FTP site and we will utilize the HRSA-HAB fiscal monitoring standards. And only if necessary, this will include interviews with the subrecipient's fiscal staff to review compliance. So this will all be done via FTP upload, which we will cover later on in this webinar. The universal monitoring review will also be done virtually via FTP upload, and we will utilize the HRSA-HAB universal monitoring standards. And also, if there are any issues in this, it will include interviews with the subrecipient program and admin staff to review compliance. And last but not least, the fun part, the service category chart reviews. This will be done via Zoom, and we will utilize the Tarrant County Ryan White Service Standards and HRSA-HAB programmatic monitoring standards to do this virtually. So you will have a Zoom meeting with all of us to go through charts. All right, fiscal monitoring, the fiscal review timeframe. We will be requesting reimbursement requests for the month of January 2022. It will be reviewed for compliance to the uniform administrative requirements and cost principles to CFR 200, 45 CFR 75, and HAB program letters. You will be given the fiscal monitoring tool. Please complete that and upload the tool and supporting documentation to the respective folder in the FTP site. Then you will upload documents for supporting documentation for compliance into the collaborative research FTP site for review as well. So we will be asking you to fill out the fiscal monitoring tool, which we will give an example of shortly. And then when you fill that out, each question then reverts back to what compliance documents we are requesting. Then if necessary, only if necessary, the subrecipients will be required to designate a knowledgeable staff member to participate in a fiscal monitoring interview with the CR team. Subrecipients will demonstrate compliance to fiscal policies and procedures and answer questions from the monitoring team. This comes across only if we come up to something where we might have asked for something and your team didn't really understand what we were asking for and might have uploaded the wrong thing. So we would only just ask for supporting documentation to fill the void of the question that we had asked. All right, our fiscal monitoring requirements, limitations of use, unallowable costs, income from fees, imposition and assessments of client charges, financial management, property standards, cost principles, auditing requirements, and fiscal procedures. These are all the basically the chapters of the fiscal monitoring tool that we have broken down. Documents used for compliance in each of the above, never mind. In each of the above sections should be uploaded to the FTP site for review. Thomas with that trigger happy finger there on me. All right, so as I said, these are kind of broken down into chapters. So all of the questions in the tools have been broken down on the side here, as you can see, with subcontractor services, time and effort. So the questions like this is number 42. Do you have subcontractors, including contract employees funded by Ryan White? If yes, it specifically asks you to upload a list of active subcontractors along with the annual budget for each service provider. So that would be, with that question, if you answered yes to that, we would then have a folder in the fiscal monitoring tool FTP site for you to upload that data to. Next slide, please. Universal monitoring. Subrecipients will be asked to complete the universal monitoring tool and upload the tool and supporting documentation to the respective folders. Subrecipients are required to upload compliance documents to the Collaborative Research FTP site for review. And if necessary, the subrecipients will be required to designate an eligible staff member to participate in a universal monitoring interview with the CRT. Subrecipients will demonstrate compliance to universal policies and procedures to answer questions from the monitoring team. Again, as we said with fiscal, this will only be in the case that something was uploaded incorrectly or didn't answer the questions from the universal monitoring tool. This is nothing that we're trying to get you or trying to find a fault. We're just trying to get more clarification on anything that was uploaded. All right. Universal monitoring requirements are access to care, eligibility and determination, anti-kickback statute, and salary cap limits. These documents will be used for compliance in each of the above sections. They should be uploaded to the FTP site for review. All right, so here's a quick example of the universe. Do we have a question?
Thank you for our performance evaluation notice I was going to send out. And it's going to be a soft copy. It's not that dark, but that old printer printed it down there. Just kind of read through it, then I'm going to send out 2 of them a day. If I want to build the evaluation.
Okay. Sorry about that, ladies and gentlemen. Universal monitoring tool examples. So this is our example of the tool. These are the first few questions. As you can see here, we're asking if your organization provides EIS services or health insurance premium cost sharing assistance services. We would then ask what funding you receive, what part funding you receive that service under, and then asking for uploading documentation to support those services. And then for other things such as access to care in universal monitoring, let's go with number 8. Does your organization have policies for the provision of services regardless of the current or past health condition of the individual to be served? Yes, and then you would just upload the documentation of your policies and procedures that would answer that question. Does that make sense to everyone? Not seeing any questions coming up, so we're going to continue ahead. All right. Access to the FTP site. Subrecipient staff responsible for uploading and reviewing compliance documents for fiscal and universal monitoring will need to request access to the FTP site. A link to request access to the FTP site will be included in the site visit monitoring email. This will be included in your monitoring packet. The FTP site is web-based and HIPAA compliant. However, you should not upload any patient private health information to the FTP. site. Uploading compliance documents. Many questions in both the fiscal and universal monitoring tools will require subrecipient staff to upload compliance documents, just as we saw in the examples. The FTP site is set up to align directly with the monitoring tools. For example, if you're planning to upload compliance documents to question 10, in the fiscal monitoring tool, you will simply drag and drop the compliance documents in the FTP site under the folders fiscal question 10. If the question is not applicable to your organization, you will choose the no answer on the tool and move on to the next question. Here is an image of the first screen that you will see, the login screen for the FTP site. Once you have received your credentials to access the FTP site, you will be able to log in. So you will get the link to request your credentials. You will then receive an email with your credentials, and then you have to enter your credentials into this site. Please be careful. Do not copy and paste your credentials into the site. You will get an error message, so please type in everything. We have had problems with that before where people copy and paste directly from the email into the site and it doesn't work. So once you have received your credentials to access the FTP site, you'll be able to log in. As a reminder, do not share your login credentials. If you have additional staff who need access, they too should request access to the FTP site. All right, so here is what the FTP site will look like when you log in. So you will see your organization's folder. You will click on that, and then inside that folder will be these folders. So there will be the fiscal and universal folders, a folder for the completed fiscal tool for you to upload, and then folders correlating to each question for you to upload all of the things that you need to support your documentation. The file structure will be divided into fiscal and universal, as we see here. There's the question folders that correspond to the questions in the tools, and then you drag and drop to upload the compliance documents. That easy. If you have any problems with uploading documents into the wrong folder, just delete them out and put them into the right folder. If you have a problem with deleting them out, if you upload, say you uploaded question 9 supporting documentation into the question 10 folder, don't worry about it. We'll browse over it. If you have the question, as long as you have the question 10 supporting documentation in there. All right. Service category chart review. Subrecipients are encouraged to review the TGA service standards, PCN 1602, the national monitoring standards, and the monitoring tools to understand requirements for demonstrating compliance with each performance measure for each funded service category. Virtual monitoring will begin with an entrance interview and conclude with an exit conference. Leadership and program staff should be present at both the entrance and exit when available. During the on-site monitoring, subrecipients should designate a knowledgeable staff member to be available as a point of contact for the monitoring team. Chart pull and sampling methodology. The recipient's office has created a list of sample sizes by funding sources of unduplicated client counts. This has been organized by agency and will provide a randomized sample for each agency by funding source. So in the mini entrance interview, each site visit will begin with a mini entrance interview. This will give the subrecipient and the CR monitoring team an opportunity to introduce themselves and have a brief discussion about the strengths and challenges with service delivery for the service category being monitored. CR will conduct the mini entrance interview for each service category being monitored. Exit interview. Once each service category has been reviewed for a subrecipient, CR will schedule an exit interview to present outcomes of the monitoring visit. The outcomes will only include high-level data gathered during the chart monitoring process. Also, just real quick on that, we will be doing the exit interview, but if you guys have big days, many meetings, please don't bother to reschedule. We'll work with whoever we're working with in the monitoring to give you the heads up to pass along to you. Anything that needs to get into the nitty and gritty, we would be able to come back and follow up with you on. Here's an example of our chart monitoring tools. So this comes from medical case management. So the first things we ask for are eligibility related. So there's proof of status, proof of income, proof of residency, proof of insurance status, viral suppression. We will just be filling these out, and then we go along with supplemental data for things such as like if they have the initial assessment completed within 30 days. So we record the date of the initial contact. If they're not new, it's not applicable. If it was, we do the date of the initial contact and the date of the assessment. So that way it totals out to make sure we see how many days are on the average for first appointments.
I'm going to jump in there and say this is also a great opportunity for subrecipients to utilize the monitoring tools once you have them, kind of on an ongoing rolling basis throughout the year. So some of you may have already set up some type of supervisory review, maybe a certain number of charts throughout the year. It would be a great idea to utilize the monitoring tool from this point going forward, just to kind of help give you an idea of some areas you could utilize for improvement projects, QIPs with the CQM program, or just, some staff training with inside of your individual agencies. Mikey?
Thank you, Thomas.
Welcome.
All right, site visit reports, the final monitoring reports. Subrecipients can expect to have the final monitoring reports 30 days from the date of the last monitoring visit. Not just your last visit, but the last monitoring visit altogether. Subrecipients who are required to submit a corrective action plan will need to do so within 20 business days from the receipt of the final monitoring report. The outcomes for the site visit will be annotated using 3 categories. We will have satisfactory performance measures that are deemed satisfactory will require no further action from the subrecipient. Requires improvement. Performance measures that are deemed requires improvement will require a quality improvement project. Finding and corrective action. Performance measures that are deemed finding and corrective action will require a corrective action plan. That, as we said, will be due 20 business days from receipt of the final monitoring report. Next steps for the site visits. Collaborative Research will distribute the monitoring packets to each subrecipient by Friday, December 9th, 2022. Monitoring packets will include the official notice of intent to conduct the annual site visit, a site visit schedule, CR team members assigned to conduct the on-site monitoring, the monitoring tools, and we will resend the instructions for document upload to the FTP site. So if anyone who needs to upload things that aren't here with us in this webinar, you will have the instructions as well. Chart pull list. The recipient's office will provide each subrecipient a list of random charts to be monitored by service category. Subrecipients can expect the chart pull list at least 10 business days prior to the scheduled site visit. FTP site uploads. Subrecipients should complete the FTP site uploads of compliance documents no later than Friday, January 27th, 2023. One-on-one fiscal and universal monitoring interviews. These will be as needed, and we will coordinate with the recipient's office and the subrecipients for a date and time to conduct a one-on-one interview for fiscal and universal monitoring. And now is our perfect questions time. If anyone has any questions, please do so now. I also have attached my contact information as well as Lisa Mataya's. So you can always contact either of us regarding this monitoring visit.
Michael, this is Lisa. Do you want to address when the site visit dates will be provided?
Okay, so we are currently looking at a January 9th start date, and we will have the finalized schedule by November 30th.
Thank you.
You're welcome, ma'am.
Let me just quickly clarify on that. So the draft site visit schedule will go to the recipient's office for review on the 30th. And once they are satisfied with that, meeting their timelines as well, then we will also make those available no later than December the 9th, and that will come with your site visit packets. Please keep in mind that this is going to be a virtual site visit. So you will have the opportunity to, well, I always say, kind of make your own schedule. So while you may be assigned 3 collaborative research team members to complete the virtual site visit, we're going to leave it up to you. So let's say you're scheduled with me to do outpatient ambulatory medical case management and EIS. I'm going to ask you to schedule your staff that works best for you, because our number one priority is that you're providing services to clients, right? And so I don't want to dictate like your case manager has to be with me from 9 to noon, and that's like your peak time for people stopping by the office. So we're going to ask that you kind of coordinate with your staff when the best time is to complete the monitoring visit with us. I'll also say that once you have the monitoring tools and your site visit chart list, it could be an opportunity for you to go through and pre-populate some of the information prior to getting to the site visit with us. One thing that we will not ask you to do is to share PHI virtually, because we can't ensure who's with you, and you can't ensure who may be behind our computer as well. So we want to lessen any type of possible or probable HIPAA violations. So we will ask, that's why we're asking for specific dates of care plans or updates and assessments to really help us kind of document what that is instead of us seeing it one-on-one. And we will be completely flexible with working with you and your organization to ensure that you're able to complete the monitoring process in a timely fashion without trying to make it any more burdensome on you than we have to. Hope that kind of helped with. We know it's a new process this year, kind of doing a system-wide assessment, utilizing both universal fiscal and quality assurance monitoring. So we know there's going to be tons of questions. Again, we are here to help you. We know you're doing a great job. We see the numbers. Lisa's office sees the numbers. The numbers speak for themselves that you're doing a great job. My thing is that we have to put it on paper now so HRSA believes us, right? So we can see the numbers and outcomes. We just have to make the paperwork compliant to what HRSA is looking for. So again, we are always here to help you. So please don't hesitate in asking questions. We are here to make sure that you're successful at what you're doing. All right, so we will also make this again available virtually, so via the web, so that you're able to review this again or pass this along to more team members who may be part of the monitoring process. And I am looking forward to a successful year of monitoring with you, and really looking forward to get to know you and your services. I've met some of you in the past doing some other activities, so I'm looking forward to meeting the rest of you. All right. Mikey, anything else from you, sir?
No, sir. I'm just trying to pick off some names in the chat list of people who came in while we were already got the show on the road. Okay. So we can follow up with them to make sure that everyone gets the recording of the monitoring visit.
And so if you joined us a little later and during the presentation, if you could please drop your name and the agency that you are with into the chat box, or if you'd like to speak up and introduce yourself, now would be a great opportunity for you to do so, whichever works best for you.
Hi, I'm Carla with Samaritan House, and I just got back from a board meeting. So I would love a recording of this, since it looks like I jumped on at the very end.
No problem, Carla. We will make sure you get a copy of this. And thank you for joining us. All right, recipient's office, any other announcements from you?
I don't have any announcements. I hope everyone has a happy Thanksgiving, and we will be getting information out to y'all based on the timeline, as well as getting the monitoring calendar out by the 30th of November. So thank y'all very much, and happy Thanksgiving.
Great. Thank you, Lisa. All right, everybody, we hope you have a great holiday, and we will see you very soon. Thank you.
Thank you.